One thing that makes diving popular is that you can enjoy it in so many different environments, each with characteristics that make it special. Besides coral reefs and temperate ocean, diving's popular in lakes, reservoirs, springs, flooded quarries, rivers, and human-made dive sites. In all of them, 6 environmental conditions affect you as a diver, though how and the extent depend on the environment. In most environments, temperature varies seasonally, but water also tends to form temperature layers, getting colder as you go deeper. The depth at which you find colder water depends on the environment, season, and water motion. What's important is to wear exposure protection based on your planned depth. Visibility can range from just a meter or a few feet to more than 30 meters or 100 feet. It's usually defined as how far you can recognize a diver horizontally. Like a dust storm in air, lots of particles in the water reduce the visibility. Water movement, weather, plankton, and the bottom composition can all contribute to suspended particles and lower visibility. Lower visibility doesn't necessarily mean a poor dive. What you see is more important than how far. But lower visibility can make it harder to stay with buddies, so stay close, take your time, and watch each other. Navigation usually requires more attention, and it's easier to get disoriented while descending and ascending. As you've learned, it's easiest to descend and ascend along the bottom or a line, and this is especially true in lower visibility. But you can use your dive computer to watch your depth if you don't have a reference. If the visibility is so poor that you wouldn't have fun, it's usually best to not make the dive or end it if you've already started. Clear water can cause disorientation too. Again, a reference helps. You can also get too far from your buddy even though you can see each other. Remember to stay close. The 2 types of water movement that affect you as a diver are waves and current. We'll look at how waves affect diving later in this section. Currents affect diving because you can't swim against any but a very weak one. So you need to use the appropriate techniques. Because they're often strongest at the surface and weakest near the bottom, plan a dive in a current so you avoid long surface swims. Begin your dive swimming into a mild current. That way, when you turn the dive, the current helps carry you toward your exit point rather than pushing you away from it. Especially on the surface, don't swim against anything but a very weak current. Doing so can exhaust you. Swim across the current to reach shore, to reach a line trailed behind the dive boat for this purpose, or to get out of the current, depending upon the situation. When boat diving, if you can't get to the boat due to a current, remain calm, stay with your buddy, inflate your BCD, and use your signaling devices to get the boat to pick you up. Drift diving helps you deal with currents by letting you float with them. It's an exhilarating way to dive that's popular where strong oceanic currents prevail. You can learn the techniques in the PADI Drift Diver course. The bottom composition may be silt or mud, sand, rock, coral, or vegetation, with more than one common at most dive sites. Regardless of type, avoid bottom contact as much as possible so you don't stir it up and reduce the visibility to help avoid cuts and stings, and so you don't damage aquatic life. Stay neutrally buoyant with your gear streamlined well above the bottom. If you must contact the bottom, choose a place without sensitive aquatic life and hazards and settle onto it gently, ideally with little more than fin tip contact. When you're close to the bottom, watch where you put your hands and feet. When wading in or out during a short dive, some bottom contact is unavoidable. If necessary where you're diving, wear wetsuit boots to reduce the risk of cuts from rocks or stings from stepping on aquatic life. Wade just deep enough to start swimming. Sunlight affects how much light you have underwater, but it can also cause sunburn, perhaps the most common injury divers get. But it's easy to avoid. Use sunscreen and stay in the shade when you can. Cover up with clothing and remember that you can still burn when it's overcast. Repeated long-term exposure to bright sunlight can damage your eyes, so protect them with good quality sunglasses. There's great diving in both freshwater and saltwater. Your skills apply to both, but a few differences generally apply. Freshwater is less dense and you don't need as much weight, so check proper weighting when going from salt to freshwater or vice versa. Marine environments tend to have more aquatic life and more water motion, waves, currents, and tides. Freshwater environments are more likely to have bottoms that stir up easily and have distinct cold water layers as you go deeper within the recreational depth range. As a diver, you develop the ability to assess dive conditions. You learn to do this from your instructor, other divers, and experience, so that you can assess dive conditions based on the weather, season, water motion, how the water looks, reports online or from other divers, and dives you've made at similar sites. Your assessment includes deciding whether or not to dive. If you have a concern, get more information about how to handle it if you can. If you can't address the issue, then go elsewhere or dive another day. Remember that ultimately, you decide to dive. You are responsible for your own safety, so only you can make the final decision to dive. As discussed in Section 1, an environmental orientation helps you learn to address what's unique to an environment. You learn to assess conditions and to eliminate potential concerns. Orientations improve your safety, but they also make your diving more interesting, rewarding, and enjoyable. Every diver has limits. Whether you're new or very experienced, dive within your limits. This means you don't exceed your training and your experience limits. It also means you stay within your comfort limits. This is important because data suggests that failure to dive within personal limits contributes to incidents and accidents. It does this because some forms of diving may have hazards that may not be obvious. It takes training to recognize and avoid them. It can cause false security. Sometimes, if nothing goes wrong, a diver exceeds limits, like entering some wrecks without proper training or gear, and gets away with it. Unfortunately, this encourages doing it again. When a problem arises, though, the diver is completely unprepared to deal with it. Anxiety can cause divers to neglect potential problems. This happens when divers know they've exceeded their limits and focus on that so much it distracts them from other concerns. Expand your limits by continuing your education and gradually gaining experience. Don't let peer pressure influence you to dive beyond your limits or comfort. Suggest a more conservative dive, or dive with another buddy who will dive within your limits. This is not only the better choice for safety, but you'll enjoy yourself more because you can dive with confidence instead of worry. The unique life you see underwater is one of diving's special appeals. It may be your main reason for diving. Most aquatic organisms are fascinating, beautiful, and harmless. As a diver, your interactions can be passive or active. Generally, interact passively, which means leaving aquatic life undisturbed. Swim slowly and smoothly, sensitive to the underwater world around you. The less you disturb, the more you see. Active interactions are those that directly affect aquatic organisms. Some, like touching, moving, or frightening them, are harmful and should be avoided. Some active interactions are reasonable, but more may be harmful, even when that's not what you intend. So keep your interactions passive. Most animals you see are harmless, but a few can injure you. Broadly, we can group these as those that can sting and/or puncture, and those that can bite. Those that can sting or puncture include jellyfish, fire coral and their relatives, spined fish like lionfish and scorpionfish, stingrays, sea urchins, and cone shells. Those that bite include moray eels, sharks, barracuda, octopuses, and lobsters, and crab. Most aquatic life injuries result from a diver being careless and provoking a defense reaction. You can greatly reduce the risk of aquatic life injuries by treating all organisms with respect. Stay well off the bottom, wear an exposure suit and gloves if allowed in the area, and watch where you put your hands and feet. Don't touch aquatic animals, particularly those you don't recognize. If you see a potentially aggressive animal, like a large shark, remain still and calm, on or near the bottom. Don't swim toward it, but keep an eye on it. Chances are it's just passing through. But if it appears aggressive or too curious for your comfort, calmly swim to your exit on the bottom and leave the water. Most aquatic life injuries are mild, but can range from annoying to life-threatening. In all cases, give priority to breathing, providing CPR, and controlling severe bleeding as needed. Provide first aid and seek emergency medical care for clearly serious injuries, severe reactions, or those that don't respond to treatment. You learn more about these types of emergencies in the PADI Rescue Diver and Emergency First Response Primary and Secondary Care courses. When it comes to injuries by aquatic life, you normally think of animals, but kelp and other vegetation can have some hazard potential. The primary one is entanglement, so keep your kit streamlined and stay out of dense growth areas. If you get snagged, back up, but don't turn. That tends to make things worse by wrapping it around you. Get your buddy to help free you if necessary. Shore diving is popular and your only option in some places. Begin a shore dive by evaluating conditions and planning the dive with your buddies. Typically, you gear up with everything except your mask, fins, and snorkel. Then, walk to the water and put on your mask and snorkel before you enter. You may wade in and back out, but in some locations, you may enter with a giant stride from a dock and exit up a ladder, or use stairs to and from the water. If you wade in from shore, pay attention to bottom composition and hazardous or fragile aquatic life you might step on. Wearing foot protection may be wise. A common technique is to wade until you reach water deep enough in which to swim and then put your fins on. Then, depending on the dive site, you may descend and swim out on the bottom, or swim on the surface and descend along a float line. Generally, you ascend and exit by reversing these steps. Keep in mind that you can't wade in some environments, so you need to reach water deep enough in which to swim some other way. And when planning your dive, remember to plan to save enough air to use during your exit. Some dive sites require entering through mild surf. As a new diver, this means entering on a gently sloped beach with waves about waist high or less. Understanding water motion principles will help you enter through mild surf. Waves break, that is, form surf, in water slightly deeper than their own height. The bottom drags, and then they tip over. So, by noting where waves break, you can get an idea of the depth. Waves cause surge and undertow. Surge is a back and forth motion caused by waves passing overhead. The main concern is to not let it push you against rocks or anything hazardous. As you get deeper, surge dissipates. Undertow is water from breaking waves flowing back to sea under the incoming waves. The larger the waves and steeper the beach, the stronger the undertow. The main concern is that it can cause you to lose your balance, but in mild surf, it isn't very strong. Waves usually approach shore at an angle, which causes a longshore current. A longshore current flows parallel to the shoreline and tends to move you downshore during the dive. You can plan for this by swimming into the current during the dive or planning to exit somewhere downshore. Sometimes, waves push over an obstruction that blocks water from flowing back to sea on the bottom. When this happens, the water may funnel seaward through a narrow opening. Past the opening, the flow dissipates. This is called a rip current. Rip currents can be alarming because they carry you away from the shore rapidly, and they're too strong to swim against. Most accidents involving rip currents result from panic, not the current. If you get in one, don't fight it. Inflate your BCD and swim at a sustainable pace across it until you're clear. Then swim back to shore. Some areas may have recommendations specific to local rip currents. A wind blowing from shore can push surface water out to sea. This causes an upwelling, which is deeper water rising to replace the surface water. Upwellings tend to make dive conditions clearer but cooler, so you may need more exposure protection. The moon and the sun's gravities pull on the oceans, causing a slight bulge. As the Earth turns, this causes the tides, a rise and fall in the sea level. Tides cause currents, especially when they flow in and out of a narrow area, affect the depth, and can change the visibility. Tidal changes range from significant to unnoticeable, but they're very predictable. Generally, the best time to dive is at high tide. You can find local tide times and heights online or with an app. If the tide changes are significant, ask a local dive professional for an orientation to local techniques. Now let's look at the techniques you use to enter through mild surf. Start by watching where the waves break and their pattern, so you enter when waves are absent or at their smallest. Enter with everything in place except your fins, breathing from your regulator, and have just enough air in your BCD to float. With your buddy, wade quickly to deeper water. When a wave comes, stand like this for stability, and so your mask and regulator don't get dislodged. If you're using a float, tow it behind you. In water deep enough to swim, pull on your fins and surface swim out. The idea is to pass through the surf as quickly as you can. Switch to your snorkel to save air if you're going to surface swim a bit before descending. At the end of the dive, surface outside the surf zone. Check the wave pattern and time your entry for a lull. When ready, switch to your regulator and swim shoreward on the surface with your buddy. In water shallow enough in which to wade, deflate your BCD so you can stand and walk firmly. Watching the waves, remove your fins and wade ashore quickly. Brace as waves pass like you did before. If you stumble and waves make it hard to get up, don't try. Just crawl until you're almost out, then get your buddy to help you up. As a diver, you'll almost certainly dive from a boat. To prepare for a boat dive, inspect your gear ahead of time and be sure it's marked so it doesn't get mixed with someone else's. Space will be limited, so pack so you can work in and out of your bag. Put what you need last on the bottom and what you need first on top. Take what you want for your time aboard: dry clothes, beverages and snacks, sunscreen, towels, and so on. Prepare yourself by being well rested and properly fed, but also by taking steps to prevent seasickness. Seasickness rarely has long-term health effects, but it can ruin your trip. Suitable medication is available over the counter in most areas, but consult your physician if you have questions about what's appropriate for you. Underway, stay in open, fresh air and look at the horizon. If you start to feel ill, don't go into the head, you'll feel worse, and stay away from engine exhaust. If you think you're going to be sick, as a precaution, take someone with you and go to the leeward rail. Arrive for a boat dive well ahead of the departure time and stow your gear as the crew directs. Charter dive vessels usually have a roll call before departure. This is important for your safety because they will call roll or use some other procedure after each dive to be sure everyone's aboard. Follow whatever procedure the crew uses. Boat rides can take minutes or hours. If the ride's very short, you may gear up before the boat leaves dock. More commonly, though, you set up your kit, but wait until you reach or near the dive site to plan the dive with your buddy, get into your suit, and gear up. After setting up your gear and checking for a full cylinder, close the cylinder valve and purge the regulator until you get to the site. Be careful moving around carrying or wearing gear. It's easy to lose your balance on a rocking boat. Be sure to secure your equipment, even if you just step away for a moment. Waves or even boat wake can cause it to fall and injure someone, to break something, or to go overboard. Most dive boats have racks and bungees for this purpose. If not, lay your kit on the cylinder and block it so it can't roll or slide. At the dive site, the dive master briefs everyone about the site, including what's interesting to see, possible hazards, conditions, and other information you and your buddies will want for planning your dive. If it's the day's first dive, it may also cover general diving procedures, safety issues, and other information that doesn't have to be repeated. It usually includes the diver emergency recall signal. Be sure you know what the signal is and what you should do if you hear it. After the briefing, check conditions and the current direction. After making or reviewing your dive plan, you're ready to kit up and get in. Diving from small boats, you may gear up, perform your pre-dive safety check, and back roll in. Or you may float your kit and get into it after you get in. On large dive boats, you typically get into your kit seated, put on everything except your fins, and conduct your pre-dive safety check with your buddy. Then, go to the entry area and let the dive master know you're ready to go in. Put on your fins, get a buddy or hold on to something for balance, and give the dive master any special equipment you need him to hand you after you're in the water. The crew will usually recommend an entry technique suited to the boat, the conditions, and your physical characteristics. The best entry is usually the easiest one. Diving from a boat, depending upon conditions in the depth, you follow a line to the bottom. At many sites, you then follow the bottom deeper to your planned depth, swimming into the current as you already learned. When you or a buddy reaches a time, air, or other limit, you turn the dive and head back. When you reach the line, use it as an ascent reference and make your safety stop next to it, or hang on a bar or separate line many boats put over the side. As you pass under or alongside the boat, stay well away from the boat propellers. Do not approach or get near them, even when the engine is not running. Boat propellers can inflict catastrophic injuries, often fatal, with little warning. So treat them as though they will start turning at full force at any time. After your safety stop, surface in front of or next to the boat. Make yourself buoyant and signal the crew that you're okay. If there's no current, you may surface at the boat's ladder. If you have to surface away from the boat due to low air or to find it because you became disoriented, watch for boat traffic. Use your surface signaling devices to make yourself more visible if appropriate. Do not swim just below the surface. You're not visible to boats and could be hit by one. Either be at the surface and visible, or deep enough to be safely below boat traffic. How you exit the water into a boat varies. On larger dive boats, it's common to use the ladder exit you saw in Section 2. Diving from small boats, you usually don't have a suitable ladder. So it's common to get out of your gear in the water, climb aboard, and then pull up your gear. Keep your fins on if they'll help you exit. If physical limitations keep you from climbing a ladder, you can usually use this technique just as well diving from a large boat. You use lines to dive in mild to moderate current without getting swept behind the boat. After your pre-dive safety check, you typically enter the water. Then pull yourself along the swim line to the mooring or anchor line. Use the mooring or anchor line to maintain your place as you descend. You may have to go down hand over hand. Typically, the current will be weaker on the bottom. Swim into it for your dive. For your ascent, return to the mooring or anchor line and ascend along it. Make your safety stop, then ascend to the swim line. Follow the swim line to the ladder or trail line. Hang on to the trail line until it's your turn to exit. If you lose contact with a line and can't regain hold in the current, surface and swim quickly across the current to intercept the trail line. Should you miss the trail line, inflate your BCD, signal the crew to be picked up, and deploy your surface signaling devices. Relax. It may be a bit before all other divers are aboard and they can come after you. The crew may advise you of other procedures they use for diving in currents. It's highly unlikely, but if you surface and the boat's not in sight, stay calm, establish buoyancy, and wait to get picked up. The boat may have slipped from its mooring or anchor, or the captain may be dealing with an emergency. If there is a mooring or anchored float in place, hang on to it. Deploy your surface signaling devices so it's easier for the boat to locate you when it returns. If the shore and a reasonable exit is close enough that you can realistically expect to reach it without becoming exhausted, swim slowly toward it. Generally, dive planning has 4 stages. Advanced planning is the decision to go diving. You decide on a buddy, choose a dive site, agree on an objective, schedule logistics, and generally check dive conditions, as well as weather, surf, tides, and so on. Start preparation planning a day or more before you go. Inspect your gear and have your cylinder filled if necessary. Recheck conditions if it has been several days since you last checked, and start packing your gear as appropriate. Last-minute preparation is what you do right before you head out. Recheck conditions, if appropriate, for last-minute changes. Let someone know where you're going, including when you expect to return, what to do if you're late, and your mobile number. Gather personal items that you want with you, like your certification card, sunscreen, smartphone or tablet, beverages, and so on. Pack your gear bag with anything left remaining, and double-check that you're not forgetting anything. Pre-dive planning is the actual dive plan based on what you find at the site. You want to anticipate, discuss, and plan for as much as reasonably possible. Evaluate whether conditions are acceptable. Take as much time as you need. If not, find another site or cancel the dive. Agree on techniques, including where and how to enter and exit, and your course. Review signals and communications as needed. Agree on buddy separation procedures and on time, depth, and air supply limits. You should also discuss what to do if an emergency arises. The dive planning slate has prompts to help you with pre-dive planning. Diving's safety record is better than many other sports and activities, but it still has hazards and risks. You can't breathe water, so common sense tells us that being in and underwater presents some hazards and risks. And you've learned some of the risks associated with breathing compressed air. Much of what you learn as a new diver helps you reduce and manage risk. But like most things in life, you can't eliminate it entirely. To reduce the likelihood of problems, dive within your limits. Stay fit and keep your skills sharp. Follow safe diving guidelines, have the recommended equipment, and do as you've been trained, even when it doesn't seem necessary. Remember that under stress, you tend to do what you do by habit, so maintain habits that help you prevent and deal with problems. You're human, so you will make mistakes. Following proper procedures and having required equipment helps offset this by providing a margin for error. With proper diving habits and equipment, you'll have fewer problems, and the ones you do have will usually be small. You'll be better prepared to handle problems quickly and effectively. The next subsection introduces you to basic problem management, but consider that continuing your diver education expands and refines what you'll learn in this course. For instance, it's recommended that you complete the PADI Rescue Diver and Emergency Oxygen Provider courses, as well as Emergency First Response primary and secondary care training, especially if you plan to dive away from immediate assistance by paramedics, lifeguards, and professional dive guides. Most diver in distress situations occur at the surface. You can prevent or control most of these by doing what you've been taught. Diving within your limits, relaxing while you dive, and establishing and maintaining positive buoyancy when you're on the surface. If you have a problem on the surface, immediately make yourself buoyant. Inflate your BCD or drop your weights. Stop, think, and then act. Ask for help if you need it. That often avoids a small problem becoming a big one. If you need to help a diver at the surface, you have to recognize that he needs help and his state of mind. Divers who are in control, not panicked, usually signal or ask for assistance. They appear relatively relaxed and move with controlled, deliberate actions. They usually respond to and follow instructions, keep their gear in place, and make themselves buoyant. Divers out of control, panicked, act instinctively out of fear instead of using deliberate, controlled actions based on their training. They will struggle violently and expend tremendous energy staying at the surface, even until becoming exhausted. They typically don't establish buoyancy, but will climb on anything or anyone to keep from sinking. They reject their masks and mouthpieces, have wide, unseeing eyes, don't follow instructions, and have quick, jerky movements. Panicked divers need immediate help because they may struggle until exhausted, then be at risk of sinking and drowning. Follow 4 steps when you help another diver. First, establish buoyancy for yourself and the diver. Ideally, throw or extend something that floats. If you must make contact to help, first make yourself buoyant, then inflate his BCD or drop his weights. Second, calm the diver by reassuring him. And third, help the diver establish breathing control. Have him breathe slowly and deeply to encourage relaxation. If possible and appropriate, give him a chance to recover before doing anything else. Finally, assist the diver to the boat or shore. Even divers in control may need help due to leg cramps or other problems. You'll practice diver toes during training. An unresponsive diver at the surface may have inhaled water, blacked out due to fatigue and exhaustion, had a heart attack, suffered a lung overexpansion injury, or have some other serious condition. He needs immediate help. The primary concerns are to check for breathing and to begin rescue breathing if it's needed. A diver who's floating face down at the surface may be resting or watching what's underwater, but he could be unresponsive. Good buddy communication avoids confusion, but check responsiveness if a diver floats motionless like this for more than a few moments. Assume a diver who floats in an odd position or who panics and then stops moving to be unresponsive. To assist an unresponsive diver, establish buoyancy for yourself and the victim. Call for help to the boat or shore. Check for breathing and provide rescue breathing if he's not breathing. Finally, get the victim out of the water while continuing rescue breaths if they're needed. We'll look at what you do after you get out shortly. Again, you prevent or control most underwater problems by doing what you've been learning. Relax while you dive. Plan your air use with your buddy and watch it closely. and dive within your experience and training limits. You've learned about overexertion previously, but let's review it because it's a common underwater problem. You help prevent overexertion by staying relaxed, breathing slowly and deeply. Avoid strenuous activity. If you start to overexert, you may feel air-starved if you demand air faster than your regulator can supply it. If it happens, don't ignore the feeling. Remember that you stop, hang on to something that you wouldn't harm if you can, like a piece of dead coral in this case. Relax, breathe slowly until you catch your breath, then continue at a reduced pace, or abort the dive if necessary. Your scuba regulator is designed so that if it fails, it free flows like this, rather than cutting off your air. You can breathe from a free-flowing regulator, but don't seal your mouth on it, partly because there's some risk of lung overexpansion injury if the flow's high, but mainly because it may come out of your mouth or flood your mask. Instead, press it to the outside of your lips like this, letting the excess escape. Insert one end of the mouthpiece if it helps, then breathe the air you need by sipping it from the flow, somewhat like drinking from a water fountain. Start up promptly because a free flow will exhaust your air supply quickly, but ascend at a safe rate. Obviously, have the regulator professionally serviced before using it again. You'll practice this skill during Confined Water Dive 4. In the aquatic plant discussion, you learn that entanglement is rare. Fishing line, loose line off a reel, and old fishing nets can entangle, but you can usually avoid the problem by moving slowly, being alert, watching where you're going, and keeping your kit streamlined. If you do get entangled, it's not usually an emergency if you have adequate air. Don't turn or twist. That wraps line around you. Stop, think, and then calmly and slowly disentangle yourself. Get your buddy to help, and if you're severely entangled or low on air, carefully use your cutting tool if that's faster. In rare, extreme cases, you may have to slip out of your scuba kit to clear it, which you'll practice during your confined water training dives. You've already learned a lot about low air and out of air situations. Planning air use, including a reserve and watching your SPG, usually prevents them. Always head up while you still have enough air for a proper ascent. It's better to have a long surface swim than to run out of air underwater. In the event of an out of air situation, you have 4 options. One is to make a normal ascent when you still have some air but feel significant breathing resistance. You get more air as the surrounding pressure drops, so breathe lightly and make a controlled, continuous ascent, no safety stop, to the surface. An alternate air source ascent is your best all-around choice. You're already familiar with this and you practice it many times during training. If you're not as close to your buddy as you should be, have no independent alternate air source, and are 6 to 9 meters or 20 to 30 feet or shallower, a controlled emergency swimming ascent, or CESA, is another response. Simply look up and swim to the surface, making an ah sound to assure that you exhale to avoid lung overexpansion injury. You will learn this first by swimming horizontally in confined water with your instructor. Ascend at a safe rate. Keep your regulator in your mouth and keep all your gear in place. You'll learn more in the Your Skills as a Diver section. You would use a buoyant emergency ascent if you were too far from your buddy, had no other alternate air source, and were so deep that you don't think you'd make it to the surface any other way. Ascend just as in a controlled emergency swimming ascent, except drop your weights. You'll exceed a safe ascent rate, but that's better than staying on the bottom. Make an ah sound and flare out your arms and legs as you near the surface to slow down. When you reach the surface in any out-of-air situation, your low-pressure inflator won't work. If necessary, establish buoyancy by dropping your weights or inflate your BCD orally. An unresponsive diver underwater is a serious emergency. The priority is to get the victim to the surface. Use her BCD or drop her weights if necessary. Hold her regulator in if it's in place, but if not, don't waste time putting it back. Ascend at a safe rate, keeping yourself safe because you can't help someone if you're in trouble. If you lose control of the victim, let her rise to the surface ahead of you. At the surface, follow the procedures you saw earlier. Unresponsiveness is unconsciousness or being unable to respond or act coherently. Near drowning, pressure-related injuries, and medical conditions like a heart attack can cause difficulty breathing, unconsciousness, unclear thinking, visual problems, paralysis, chest pain, lowered alertness, cardiac and respiratory arrest. Once out of the water, your priorities for helping someone who is or was unresponsive are: assure breathing. Keep the airway open